According to the WHO, 50% of the entire world lacks access to essential medical services. We're seeing about 8.6 million people die annually from preventable and treatable conditions. This is because millions of these people receive absolutely no health care at all. The providers they often need to see aren't available or just not accessible. What we often see are medical mission trips that happen sporadically to treat patients in low-resourced communities around the world. And though these providers have good intentions, this often ends up becoming unsustainable and expensive when fees for flights, lodging, and meals rack up. What if there was a way to completely cut out the step of physically traveling to a country in need by inserting a technology that will connect providers across the world to treat these patients? All you need is some Wi-Fi and a reliable power source. Introducing World Telehealth Initiative, the leader in philanthropic virtual care, a nonprofit that provides sustainable medical expertise to vulnerable communities worldwide. WTI partners with hospitals and clinics in low-resource regions, offering to support and mentor healthcare providers in these regions. I'm so excited because today I get to feature Sharon Allen, CEO of World Telehealth Initiative, and we're going to talk about her passion in starting this life-saving organization, why it's so needed in low-resource settings. We're going to talk about the innovative technology that connects providers from all around the world and its impact so far. Before we dive in, here's a little bit about Sharon. Sharon Allen is the co-founder and the Chief Executive Officer of World Telehealth Initiative, or WTI. As a recognized leader in international philanthropic telehealth, Sharon is often invited to speak at notable conferences, including the American Telehealth Association, the White House Telehealth Innovation Summit, Nigeria's Healthcare Today keynote, MENA Telehealth Conference, Telehealth Innovators Forum, AAFP Global Health Summit, and more. She's traveled extensively to understand the needs of low-resource healthcare clinics and hospitals worldwide. Under her leadership, WTI has developed an innovative model that leverages remote philanthropic physicians to provide sustainable medical expertise via telehealth. Since its founding in 2017, WTI has established remote specialist care and training to on-site providers in many underserved communities throughout the world. Sharon has been selected to serve on the World Health Organization Digital Health Board of Advisors and roster of experts. She's currently working with the WHO on their telehealth roadmap for the underserved. My name is Hetal Bauman, and this is the Global Health Pursuit. Sharon, I'm just so excited to have you on the podcast. It's just always so refreshing to speak to you. I know you came on the podcast the first go around, and we're going to talk about that and so much more on this episode. So thank you for coming on. I always appreciate your time.
It's my pleasure. I love speaking with you and I love what you're doing. So happy to be here.
Thank you so much. Sharon, I think first things first, I really want to discuss your background. Just briefly, can you tell us your story?
Sure. So, as many people, I've had a very circuitous route to
I love that word.
Where I am today. Part of my background was right out of college. I actually worked for the airlines, and I did that specifically to enable my travel around the world. So I did that for a short amount of time. I went to every corner I could. I think I was up to 36 countries.
Wow.
And then I decided I should probably, get a serious career. And so I found myself in the business world. And through that process, as often happens, I took the first job that seemed suitable, But then I grew in that career and grew and grew. And then the last decade of that, I was the CEO for a multi-branch distributor company in Southern California. And I was always learning. I enjoyed the people I worked with. I loved nurturing this demographic of people that were in that industry. But it wasn't necessarily what was, what my heart wanted to do.
Mm-hmm.
So about 7 years ago, I took the leap and I left that career. And I wanted to take 6 months and just explore my options. I had never really done that before. And so
you took a gap year.
Gap
6 months.
I intended to take a gap 6 months. It turned out to be a gap 2 months. So,
oh my God.
But it was a gap nonetheless.
Yeah.
The youngest of my 4 children is adopted. So I was looking into nonprofit adoption opportunities. And that route led me, when I was talking about nonprofits, to a meeting with Dr. Yulin Wong, who created InTouch Health, which is the largest provider of telehealth in the developed world.
Mm-hmm.
And so in that meeting, it changed my life. He was saying, we have this amazing technology. He could see what it's doing in, high income countries,
right?
But always wondered, could we provide healthcare access for half of the world that doesn't otherwise have it on a nonprofit basis? Clearly, many people can't afford this high-end technology. So the technology component was there. And then the question was, what if we utilize philanthropic providers that want to do this type of work? So it seemed like the answer was there, sitting on a shelf, and somebody had to implement it. I wouldn't have.
So serendipitous. Can you imagine having a conversation and then the light bulb go off? Whoa, we could do this.
That's exactly right. It was and he, really founded the idea. He was the visionary behind it, but he did not have the bandwidth to do that. Mm-hmm. He hadn't recently left his career and had time on his hands, but somebody in the room did. So with that, we looked into how can we do this? How can we partner with an existing organization that may be doing it to a lesser degree? But, I found out nobody was doing what we proposed to do. And therefore we launched it. And, although my road, as I say, was circuitous, those experiences really helped in the development of World Telehealth Initiative. My travel, my understanding of cultures, my, those situations played in, knowing people from every corner of the world. And then certainly my business background in starting, a new nonprofit. It's just like any startup that an entrepreneur would do. So that came into play as well. And now 7 or so years later, we're deep into the global healthcare solution. So that's how it all happened.
Oh my gosh. I feel like very few people actually, I feel like we have ideas on a daily basis, but very few people actually go after those ideas. You're one of those people. And did you even have a background in health, healthcare at all?
I did not, nor really technology, but because I was so hungry for knowledge, I wanted something new. Healthcare certainly always, spoke to me. I have many, friends that are in the field. And so it wasn't so foreign to me, but that said, I had deep learning to do and was just a sponge. And I devoted my every waking hour to it. And because it was new, nobody really had the answers for how to go forth. So somebody had to figure it out. So, why not me? Now it's been fascinating just meeting all the people that are in this, global healthcare pursuit.
Yeah. Perfect
so
words.
Yes.
So it's a telehealth technology. Now, Can you talk about the technology that, WTI uses and how it's different than the ones that we have in the States or in high-income countries?
Absolutely. So keep in mind that so InTouch merged with Teladoc, and this technology that we use is really the result of $200 million worth of technology development done by InTouch and now Teladoc, and it continues to grow and advance. And we are the recipients of that technology. So many efforts are done, especially since COVID with cell phones and, video conferencing. But the technology that we provide to our partners is purpose-built. It's medical grade technology. It's much, much more than video conferencing. It has dual cameras, one of which can zoom, 26 times. So your whole screen can be filled with, an eyeball that you're looking at.
Oh my gosh,
has little
cool
features like directional audio. So for example, in our hospital in Bangladesh, they have a metal corrugated roof, and in monsoon season, it gets very loud in that clinic. But with directional audio, wherever, the supporting provider beams, wherever they point to, it picks up that sound and muffles the surrounding sound. So all these little features are built in. One of the most powerful components is that it can be diagnostic enabled. We can plug in peripherals. So like in our maternal health care programs, we use ultrasounds. So the remote provider is seeing the live ultrasound feed, or we plug in stethoscopes. So if a remote provider is trying to help assess maybe a heart murmur, they hear that live stethoscope feed in their headphones, maybe across the world. We've used intraoral cameras, all these extra tools. And then all of that rides on a very low bandwidth requirement. So we can serve these very remote areas that didn't think they would have, access to advanced technology like this.
That's amazing. I think when you think of telehealth, you think of a provider speaking to a patient, right? So within WTI, it's a little bit different because it's almost like a provider speaking to another provider, right? For advice, for feedback, for, next steps. Can you talk a little bit about the model of WTI and how this is created?
Absolutely. And you've got that exactly right. Our mission is to provide sustainable expertise to very vulnerable communities throughout the world. And the goal is always to upskill the local providers and to build the capacity of the local healthcare system so they can take care of more and more of their own community and thereby advancing, healthcare outcomes. So, and we do this through a network of the volunteer providers that are contributing that expertise. So you're right. The local provider always maintains full responsibility of patient care. They are, the one engaged, and our supporting providers are just sharing their knowledge and expertise.
And how do you start creating those relationships with local providers in terms of, hey, this could be something that could be useful to you?
So we have not done any, hey, we're here.
Oh, hey. hey.
We started with 3 pilots that we launched just to, test our proof of concept.
Right.
And from there, it's really been word of mouth. Those programs have expanded, and then their affiliates have seen what's happening and they want a program. And so we've kind of expanded like that. Of course, when our market area is half of the world, there's more than we can get to immediately. We're working on it.
Yeah. And it would be ideal if it's just like, can you imagine you working on all of that?
Yeah. But so we do have a number of, partners in the queue. And we actually oftentimes choose those first where we know the impact can be the greatest. So we meet a provider at a hospital or clinic, we do a thorough needs assessment. Now, after being in this area, we have a lot of learnings as to what will make a successful program. And so the first thing, we do an initial technical review, make sure they do have, at least adequate internet, and then really go through this site assessment. And then once that happens, we work closely with the site to design the program. Again, it's all based around their needs and their capacity and how they envision the program. So they're the primary driver to how we engage, and we come alongside them. And then once we launch it, we continue growing and training more providers, both on site that are interested, and then connecting more supporting providers, maybe increasing their use cases or increasing their medical specialties. And then finally, all of our programs, we do monitoring and evaluation so we can continue to improve and know what our deep successes are and how we replicate those and take our learnings and improve based on that as well. So there's a process for sure for each program. And now we have 40 programs soon. We have 6 more launching very soon. So yes, we continue to grow.
It's like exponential. I feel like the last time I spoke to you, you were just starting out almost.
It has been a rather fast trajectory, and we want to be cautious and make sure that we are doing it in a very thoughtful way, and all of our partners, prior and existing and new, are served according to our standards.
Yeah, I think that's just so cool. I know it's so funny. I was like, do you just go to a clinic and say, hey, we're here? Do you guys have like an application process in terms of like for people who are interested in the service?
We do. Many times we're contacted through our website of somebody that's looking for philanthropic global telehealth, and they find us. And we always entertain those conversations, and more often than not, they do get in the queue of programs that we aim to serve. So absolutely. Oftentimes health systems in the U.S., they may have affiliations with sister sites abroad that are low resourced, and they may have a number of providers that are trying to do work there or support that organization. And they say, is there any way, we go there for 2 weeks a year. Is there any way we can make these relationships sustainable? Yes, there is. And so some of our programs have been nominated in that fashion. So we definitely explore any opportunity that comes our way.
And what's the criteria for a clinic to partner with you guys? Like, I know it's Wi-Fi, strong Wi-Fi, but is there anything else?
We do. There is such a thing as too low resourced. For example, one of our very early partners in Haiti, we request that the device is plugged in when it's not in use. Right. So we could do evergreen upgrades. And so it's always ready to use, should there be an emergent need. And they would say, we do plug it in. We do plug it in. And it wasn't until I went there that they would plug it in and it would just fall out of the socket. And it's like, okay, we should be more specific. Plug it into an outlet that can, hold the plug. Yeah. And so not only that, but then certainly with the violence that's going on there, then their providers were being kidnapped when they tried to make their way to work. And so they had to shut down that facility, which is tragic.
Oh, wow.
And so there is such a thing as, too low resourced. And in that situation, we aren't able to help them, of course, if they can't have their providers on site. in that situation, we were able to transfer the device to a location that was able to remain open. But so, we look at, there's a lot of, geopolitical considerations, safety considerations. In Nigeria, we had to have the device from the airport at 2 a.m. at night, transferred by armed military personnel because there were a lot of thieves and bandits on the road, and they were afraid it wouldn't get there. So lots of considerations that we wouldn't typically think of here that, but we work through those hurdles in order to get the equipment where it's needed and build those relationships. And then once it's done, via technology, it's actually safer than it would be by transporting patients or physicians across these fragile areas.
And I think that's really interesting that you say that, because I think with many nonprofits who work in the healthcare field, they'll bring physicians from the US and then they'll do their work for like 2-3 weeks. And then it's like almost more of a sustainable option where you're able to bring their expertise without actually having to bring them there and, pay for lodging and the flights and all of that stuff. So that makes a lot of sense.
Yes, it's really a small number of healthcare providers that can engage in that way. They have to take time off the work.
Right.
It's usually at their expense. They may have to get vaccinations. And then how sustainable is that care? And does it enhance the local healthcare system, or does it potentially disrupt the work of the local healthcare system? So all those considerations, come into play.
Yeah, I mean, what you said about disrupting the healthcare system, it's almost like you're taking over,
exactly.
In that sense. And you want to be able to give them the opportunity to empower themselves to serve the people, their own people. So I just love that.
Spot on. That's right.
So you said 40 programs, 6 on the way. Where are you working in what capacities? Like what areas of health have you worked in?
So as far as use cases, it really runs the gamut. Like I said, we have at least 50 different medical specialties that are represented. And again, because it's at the request of our in-country partners, it runs the gamut. And so now we are onboarding physicians that are interested in this work, not always knowing if we will have an immediate opportunity for them. But when we get that request from our partners, we hope to fulfill it. For example, we're doing quite a bit of work in Ukraine for the last year, and they needed a lung transplant surgeon. And I have a pretty good working knowledge of most of our providers, and I know we have many surgeons, and so, looking through our database, lo and behold, yes, we have a lung transplant surgeon. And so we connected them. And
wow.
That's
so specific too.
It's very specific. And we do have, obstetric fistula surgeons or, these very subspecialties that we can connect. I'm told that rheumatologists are a rare breed these days, and we do get a lot of requests for rheumatologists, but lo and behold, we are able to satisfy that need. So some of those providers that are more rare specialties maybe don't engage in opportunities as much as, an OBGYN or, an internal medicine specialist, but more likely than not, we will have a request from one of our programs at some time that can really, really utilize that expertise that certainly would not be available to them otherwise.
Yeah, amazing. So you mentioned that in the past year, lots of work in Ukraine. When things, I want to mind my language, like literally like hit the fan, what was the first thing that WTI did, to mobilize? Because it's almost like a disaster relief scenario.
Absolutely. And I mean, our DNA is to help people, and we know that our technology can serve in that way and be that bridge for doctors that want to help. I mean, there's so many people wanted to help Ukraine, but didn't really have the tools or didn't know how to go about it. So it was in February, very early on, we were contacted by the Ministry of Health in Ukraine and said, can you help?
Yeah.
So absolutely. We immediately shipped 8 devices. Those were deployed and brought online, and then they requested 10 more. We also sent them Surface Pros that were donated by Microsoft. And those were great because they were able to go closer to the front lines. It wasn't a full-size robot.
Right.
So we have been working closely with them ever since. We do a lot of neurology consults. Early on, they were requesting combat trauma training. They have fabulous doctors and surgeons over there, but certainly what types of things they were seeing were new to them. And so our team included ex-special forces surgeons, that helped, set up the DOD protocols for the United States. And so now they wanted desperately to help their colleagues in Ukraine. So they actually did go on site. Well, they actually met in Poland, did some trainings, but now through this technology, they can continue to support them. So there's been a lot of activity there, and that Ukraine actually now is hoping to establish, a national telehealth system. They're the way they have their health system, it's a little bit siloed, where they have a neurology hospital over here, an oncology hospital over here, orthopedics. So not only are we providing international expertise, but we are linking all of those physicians to each other in country. So when they get a complex patient that has a head wound and, internal organs, they can have all that expertise from international support or from in-country support, beam in and have their needs met at that one location.
Hey there, I hope you're enjoying this episode. And if you are, would you do me a tiny favor? Show me some love by doing one or more of these 3 things. A, click the support this podcast link in the description to donate a few dollars toward the production of this podcast. My dream is to do this full time, and your support would mean the world. B, you can write me a review on Apple Podcasts and or rate me on Spotify to give me a boost in the algorithm. Or C, share this episode with someone who would love it just as much as you do. I truly and deeply appreciate you. Let's get back to the episode. You can only imagine the amount of trauma support that they would have needed, at that time.
It's unbelievable. I mean, as everyone's remarked, about their resolve. And so we were asked to hold a conference, to come to Ukraine and hold a conference for their healthcare leadership. And some of them were early adopters of this. It's as it always is with any technology.
Yeah.
There were the early adopters that saw the value of it, got on board, got their, near colleagues on board, and were using it with great success. Some, as you could imagine, felt that the world was on their shoulders, and the last thing they wanted to do was learn something new and bring it into their workflow. And so they wanted us to come and to share the success stories and listen to the challenges and see if we could grow and expand to help them. Now with their infrastructure so damaged between, roads and trains and power, we've been able to navigate that pretty successfully. So, and this was our first rapid response effort. We usually take a while to build the relationships and do community education and all those things at the outset. But this was a rapid response effort in which we've learned so much. And so now we see ourselves positioned to do that even better, in the future for
in case
crisis
anything else
situations.
happens. Mm-hmm.
Yeah.
Mm-hmm. Yeah. You mentioned success stories. Can you talk about some of these stories that have completely motivated you to keep going?
There's so many.
No, it's so hard to pick one.
So actually in Ukraine, one of them, so of course your heart goes out for this entire country that is, feels like, they are making huge sacrifices, not only for themselves, but really they feel for the world. And so when you see these young men or older men, or civilians that have been, tragically hurt in the situation, of course your heart goes out to them. There was one soldier that came to the level 1. The bleeding was stopped. He was sent to a level 2 hospital, which is still experienced physicians. They do the best they can to stabilize them before sending them to level 3 tertiary sites. And so sometimes decisions are made there that may not be optimal. And so he had a brain injury, and they fixed it as best they could there at that facility. When he came to the level 3 hospital and they saw what the recovery would be, they wanted to help him further for a more successful recovery, but they weren't sure how. So we were able to bring in neurosurgery expertise in this situation. It was out of Canada. And he was suggesting a new procedure. They weren't familiar with it, but he was able to walk the on-site physicians through it. And now that patient is recovering beyond their best expectations. And so seeing this young man with his life, really full ahead of him, and to think that it could have been drastically affected negatively, but now to see what this expertise enabled, that's all sorts of stories like that.
That's just the goal, right?
Yeah. The goal. Let's get the healthcare to where it's needed, and the expertise is there. We just have to get it to where it's needed.
Wow, that's amazing. In terms of WTI and the future of WTI, what do you see? What do you see for the future?
The future is huge. So we did a lot of this matching between clinical needs to supporting physician expertise. We did a lot of that quite manually at the outset. And now we're well on our way to this robust matching platform that will enable the clinics to simply be able to enter their needs. It will go out to all of the appropriate physicians or healthcare providers in our network, and they may get 10 responses that say, I want to do it. And they may pick this one because they've worked with she or he before, or this one because they're Bangladeshi diaspora, or whatever they want to base it on. And so it will automate a lot of our processes, enable us to expand and, scale appropriately and make a much larger impact in global healthcare. And so it is a matching platform at its core, but the big vision is creating a global healthcare ecosystem that brings these physicians and healthcare providers together to satisfy specific medical needs, but also it will enable them to collaborate with each other. And so, we've had quickly another story that is an example of what WTI enables. And an infant was born in Bangladesh with edematous legs, and she was actually orphaned because the parents didn't think they would be able to care for her. And so that hospital requested a dermatology consultation, and we set that up, and a dermatologist said that it's not my field. I would suggest infectious disease. We had an infectious disease expert. This one was actually out of South America. And he thought it was this rare disease. And then he asked, can I talk to other infectious disease experts in your network? We really like to collaborate on these rare diseases. Pretty soon I was privy to be on this exchange, and they were all collaborating and sharing research and weighing in on the diagnosis. This little baby was getting world-class expertise, and due to her condition. And we had a pediatric surgeon that was saying a vascular node transplant would solve this, but that may not be available in Bangladesh.
Right.
But we could do compression wrapping and massage to increase her quality of life. So we were able to provide a certified lymphatic massage therapist to teach them how to do that at the hospital. That's just the power of collaboration, and the desire from the healthcare providers to do this is phenomenal. So it's just, WTI is just bringing these pieces together. And so that's what I see in the future.
Oh my gosh. That reminds me of just like, when you go to the hospital or you go to a practice, right? And when like the whole term practice is like you have multiple physicians together and they're able to collaborate. But this is like, you're collaborating with doctors that are all around the world. That's just, whoa.
It's so awesome. And they love it. And I will say we refer to our volunteers as supporting providers, but let me tell you, they are getting as much out of it as, any on-site colleagues. And the learning really is bilateral, due to that collaboration of all these different providers in different settings. So they're both always learning.
Oh, wow. There's so much here. Thank you so much for coming onto the podcast, Sharon. Like I said before, speaking with you it just always energizes me. So thank you.
Well, thank you, Hedel. It's my pleasure to be here. Always good to see you.
Thank you for listening to this episode. If you'd like to learn more about today's topic and guest, head over to the show notes linked in the description of this episode. There, you can get access to resources, links, and ways you can get involved in the pursuit for global health. And if you loved this episode, don't forget to write me a review on Apple Podcasts and rate the podcast on Spotify. It helps me get in front of more people just like you and continues to elevate the causes we are so passionate about. I'll see you in the next one.